disease had I not been misdiagnosed during my heart attack and sent home from emergency. And that's the only difference between me and anybody else who feels symptoms that they suspect might be heart related, and then they go and seek help and they're correctly diagnosed and correctly and appropriately treated. And then they go back home and start healing and recuperating. And that would have happened to me, except that I was sent home in the middle of my heart attack. And my symptoms hit right out of the blue. It was early morning. I'm an early morning walker. It was about 6 o'clock. I was out walking, and suddenly, out of the blue, these symptoms that I'd never had before hit: central chest pain, nausea, sweating, and pain down my left arm. And it was that pain down my left arm that frightened me, because I remember reading or hearing that pain down your arm could be a heart attack sign. The symptoms were so severe that I had to stop walking, and I was leaning against a tree just to hold myself up. And I was really alarmed again by this arm pain. But and there was nobody out on the street. There were no commuters, no dog walkers, nobody who could help me. So I waited. I didn't know what I was going to do because I could not walk. If I let go of that tree, I wasn't sure I could stand. But after a few minutes, something magical happened, and I felt a little bit better, and the symptoms seemed to ease up. And so I started walking very carefully, left, right, just to see. And I was walking okay. And my first thought was, as I was leaning against the tree, was, this better not be a heart attack, because I do not have time for this today. Like maybe tomorrow, but not today. Today's not a good day for me. But as my symptoms eased up, then I thought, oh, well, I'm glad that's over, whatever that was. And I continued upon my day. But I had to walk past the Royal Jubilee Hospital here in Victoria on my way home. And I thought, which by the way, was where I worked. I worked at the hospital. So I thought, maybe I should pop into emergency. While I'm walking right past it, I'll just tell them what had just happened. I know it's nothing, because I was able to walk and think, and I figured a person having a heart attack would not be able to do either of those things. But I decided to stop in to emerge just in case. So I went in, and it was a rare morning, again, very early, and there was no lineups in the emergency department. And the triage nurse came out, and I said, well, I'm having these symptoms. And I explained to her about the chest pain and the nausea and the sweating and this pain down my arm. And immediately I was taken in right away, because if you think you're having a heart attack, then what you must say is, I think I'm having a heart attack. Women tend to do just the opposite. As soon as we're there, we'll say it's probably nothing. We like to minimize our symptoms. We are more likely than men to apologize for wasting their time. But I said, here are my symptoms. What do you think? And they did all the test results or tests immediately that they would normally do for a heart patient. But all of my heart tests came back normal. And I say normal because it's very common in women that the test that they do for you to check on whether or not you've probably had a heart attack for the last 4 decades have all been done on men, white, middle-aged men, with women either not included at all in the research or included in such small numbers that they're not even taken into consideration during the conclusions. So it's quite common for women to have normal test results, even when the tests are not normal. So as soon as the test results came back, the doctor said, you are in the right demographic for acid reflux. Go home, see your family doctor, and you'll get a prescription for an antacid drug, and goodbye and have a nice life. Well, I was so embarrassed for making a fuss over nothing but a little indigestion that I couldn't get out of there fast enough. But before I left, a nurse, and remember, this is a nurse in the hospital where I work too. So this is a person I would have sat next to in the hospital cafeteria. She came up to my little stretcher and she said to me in a very stern voice, she said, you'll have to stop asking questions of the doctor. He is a very good doctor and he does not like to be questioned. I thought, whoa, I felt like I was a naughty child who'd just been smacked. But I'd only asked the doctor one question, and that was when he started talking about acid reflux, I asked him one question, which was, but doc, what about this pain down my arm? I'm not a doctor, but I knew that pain down your arm is not a sign of indigestion. But by that time, I was so humiliated and embarrassed that all I wanted to do was leave, which I did. The next day, when my symptoms returned, which of course they did, I was at work this time at the hospital at my computer, and the same symptoms happened, but I knew that I was not going to go back to emergency because it was not my heart, because a man with the letters MD after his name had told me very clearly, it is not your heart. But I thought this acid reflux is horrible. Like, how can people stand it? And over the next few days, I was asking my girlfriends, have you ever had acid reflux? Oh my goodness, it must be horrible. Like, how can people live like this? And I was in denial so much. And also, I'd rather have indigestion than heart disease. So that's why I believe that doctor and his misdiagnosis. And during the next few days, I made plans to fly to Ottawa for my mother's 80th birthday. I went back to work at the hospital. I drove my car. I walked and talked and made decisions. And that also reinforced my belief that this could not possibly be a heart attack because of my wrong stereotype of what heart attacks look like. And in my mind, a heart attack happens when a man, always a man, if I ever thought about heart disease, which was virtually never, but if I ever did think about it, I pictured a man at the golf course, an old man, old fat man at the golf course who suddenly clutches his chest, falls down unconscious, CPR, paddles, ambulance. To me, that's a heart attack. So really, how could I be having a heart attack? I could walk and talk and think and drive my car and go to work and do all the things that a normal person who is not having a heart attack would behave like. So this went on for 2 weeks, 2 weeks of me popping Tums and Gaviscon and complaining to my friends about this horrible acid reflux I was having. But at no time, even on the plane flying back from Ottawa to Vancouver, even on the plane, I had 2 cardiac events on the plane where I honestly thought, oh my God, if this is acid reflux, can somebody die from acid reflux? Because that's how it felt. But at no time did I call the flight attendant over to help me because I didn't want to be one of those passengers that they have to turn the plane around for during a medical emergency. And how embarrassing would that be for just indigestion? So instead, I just sort of, gritted my teeth and somehow got through both of those episodes. And when I got to the Vancouver airport, I know you have hospitals in Vancouver. I could have got off the plane or told somebody, I need help. I think something's seriously wrong with me. And I know I sound like a crazy person when I tell this story. And I certainly sounded like a crazy person to my grown children who couldn't believe that I didn't get off the plane or call the flight attendant over for help. But you'll see as we talk more that this is actually quite common in women. We'll take care of everybody else, but not ourselves. And that's why they tell you on the plane, put your own oxygen mask on first before you try and put it on your child. And they have to tell people that because they know women won't put it on themselves because they'll immediately think about how everybody else is doing. So that's one of my problems, is that I didn't like to make a fuss over myself. So when I finally decided to go back, when I finally landed the little short plane that goes from Vancouver to Victoria, it was very late at night, but I'd already decided that I needed to go back to emergency. But not that night. It was very late, about 2 o'clock when the plane landed, and I got my car out of the long-term parking lot at the Victoria airport, because that's where I'd parked it for the weekend. And I drove myself home, which was crazy, having these cardiac symptoms. And at the time, all I could think of was, if I could just get home, I'll be okay if I can just get home. And if you've ever been sick, and you're away from home and not in your own little bed, you know how that you're just all you can think of is getting home, and then somehow things will be better. So I drove myself home, and I decided to go back to Emerge. But because I worked in the hospital with a lot of doctors and nurses, and all nurses will tell you, you never want to go to emergency at 2 o'clock in the morning. So I decided to wait until shift change. Now, nurses will laugh at that story, but you also understand that shift change is a good time to go when the incoming staff are fresh. So that's what I wanted. I wanted fresh nurses and doctors. So I laid in my bed with my coat and my boots still on from my trip, and I waited until shift change, and then I took a taxi back to emergency for this acid reflux. But this time things were very different. I could tell by the looks on the faces of the doctors and the nurses. This time they called in a cardiologist, which they had not done 2 weeks later or earlier because they knew I wasn't having a heart attack. And the cardiologist came to my bedside and said, I remember he held my hand in both of his hands, which got my attention right away. It was very serious. And he said, Mrs. Thomas, I can tell by all of your T waves and your other cardiac tests that you have significant heart disease. And I was so shocked. I mean, you'd think I wouldn't be shocked because I was having classic Hollywood heart attack textbook symptoms, but I was in such denial, and I had convinced myself, with thanks to the emergency room doc who had, convinced me that this could not be a heart attack. This second time, though, I was rushed upstairs immediately to the cath lab, which is where they do angiograms, where they sort of thread a catheter up your arm or your groin. If you're American, it used to be groin all the time. Now it's much fewer complications if they access your wrist. They slide the little catheter up magically into your beating heart, and they can take a picture of what's going on. And in my case, they found this blocked left anterior descending coronary artery that was blocked. That's one of the largest coronary arteries that feed the heart muscle. And when that heart muscle gets blocked, then blood flow to the heart muscle is affected. And that's when your heart muscle begins to die. And heart muscle is very different, I learned, than hurting your arm muscle or a leg muscle, which can heal and recuperate. Heart muscle becomes necrotic, which means it's gone forever. So I always recommend to people, if you're going to have a heart attack, try and have a blocked artery that's at the bottom of the heart so that all the tissue below that doesn't die. Because if you have, depending on where the blockage is, can really affect how you are able to survive that heart attack. But I didn't know any of that at the time, of course. I was just so shocked and in shock, and so was my whole family. And when I got back home, that's when I started getting angry. And mostly I was mad because of that emergency room doctor. And I thought, how could that man have sent me home with those symptoms? By now, I was already asking Dr. Google, what are symptoms? What does it mean if you have central chest pain, nausea, sweating, and pain down your left arm? And there's only one answer that comes out of a search like that, and that is myocardial infarction, which is a heart attack. So I started getting mad at how this could have happened. And then I found out something even more surprising, which was it happens quite common in women. Women in my age, I was in my 50s at the time, women my age and younger are 7 times more likely than men to be misdiagnosed and sent away from the emergency department than women are. So that's pretty shocking news. I couldn't believe that it was happening to me. So one of the first things I did was I was very fortunate for me. I was on the Mayo Clinic website looking up women and heart disease. And I highly recommend this site, mayoclinic.org. And they had a little sidebar that said, are you a woman living with heart disease? Apply now to attend the Women Heart Science and Leadership Symposium for Women with Heart Disease. Well, I said to myself, I said, I'm a woman living with heart disease now. I'm going to apply. And so I did, and I became the first Canadian ever accepted to attend the Mayo Clinic Science and Leadership Advocacy Training. And it was a fantastic program. It was all expenses paid. So they flew me to Rochester, Minnesota, um, for a week long, basically what I called cardiology boot camp. There were 45 of us, all women, all living with heart disease, ages 31 to 71. And we went through this boot camp about why this happens to women, signs and symptoms that are unique to women, risk factors that are unique to women. And by the time I got back, my son said that after mom got back from Mayo Clinic, she became insufferable because no woman was safe from her. So the woman sitting next to me on the bus stop, for example, I would be saying, "Did you know that?" So I'm better now. I hardly ever do that anymore. But that's how amazing this training was. And because I was trained, part of the reason that the Mayo Clinic offers this free training to women like me are they hope that women will start paying attention to their heart health. Women pay attention to the health of everybody else in their family and other people that they care about, but we still think about heart disease as a man's problem. And that might be true for you too. You may have always pictured that old man on the golf course who clutches his chest and falls over, and that's a heart attack. It's more likely to be a sudden cardiac arrest. Heart disease, there are many different kinds of heart disease. And one kind is the plumbing kind, as I call it, where you have a pipe that's blocked, just like a pipe under your kitchen sink. It's blocked, you unblock it, and then things can work better. What the man on the golf course was having was an electrical problem. That's more typically happening to men compared to women. Women do have sudden cardiac arrest, usually as an after effect of a very serious blocked artery, a coronary artery disease problem. But in my imagination, no wonder women don't think of it as a man's problem, because if you Google heart disease, you know what kind of pictures you will find? Men, man after man after man after man after man, all clutching their chest as if they're going to fall down dead. That's a picture of sudden cardiac arrest. So no wonder, because I wasn't having any of that sudden cardiac arrest symptoms. I could walk and talk and go to work. And so I was fine, I thought, because I was believing that stereotype that Mayo Clinic still believes to this day is still present in women. And that's why they thought women are not listening to their doctors when doctors talk about heart disease. Maybe they'll listen to other women back at home in their communities when we tell them about our heart attack story and how what we learned and what all women should know. So that's kind of like the extended Coles Notes version of why you're listening to me and not some other heart patient.
Thank you so much, Carolyn. I love your story. We're going to get into some of the signs and symptoms that are specific to women. We're going to talk about how you help yourself out of that denial phase when you're in it. I just wanted to say that when I was a cardiac nurse, 50% of our beds were female. And generally, it's an older woman's problem. Estrogen protects us for a long time. So we tend not to, our heart disease is delayed, usually by about 10 years. But there are so many other things that can happen to women along the way, and stress is a major, major factor. And that's the family thing again that comes up.
I recommend that all of you look up, it's called Just a Little Heart Attack. That's the name of this little documentary. And the actress, Elizabeth Banks, which some of you may know, has a mother and a sister who live with heart disease. And women's heart disease is a cause that's very important to her. So she produced and stars in this little 3-minute film about a young mom who's getting her kids out the door for school and her husband off to work, and how she totally ignores her very clear cardiac symptoms. And it is so funny. It's not meant to be a comedy, but whenever I show this film at the start of all of my conference presentations, and they're sort of laughing and crying at the same time because she's so funny and yet she's so true. Everything she talks about, the way women deny what's going on with their bodies, is so true.
Okay. All right, I'm going to add that in a minute, and there's really no other chat. So I want to ask a few questions. And one of the reasons, and you alluded to this, is that women's priorities are different than men.
Yeah.
Can you go through that list?
Yes, the list is really interesting. See where you are on this list. This was a Mayo Clinic research study that was done many years ago. And again, it's getting back to this issue of why do women delay longer than men do when seeking help during a medical crisis, even a heart attack. Researchers tell us that women wait far longer before they will finally seek help compared to their male counterparts. So they did a study on women's priorities, and they asked women in the survey, what is the most important thing in your life? More important than getting help during a heart attack. You might think that there's nothing more important than getting help in the middle of a heart attack, but that it wasn't the reality. The reality is that's what researchers call treatment-seeking delay behavior. And this is unique to women. I know that men will often delay seeking their own treatment as well, but it's far more significant in women. So the number one response to this survey was family. Number one, especially if you have children, women rate their children and their family members far more than highly than themselves, higher priority than themselves. Number two was home, our homes, how they look, how clean they are, what people think of our homes. That was number two. And having our home is really, really important to us. Number three was work. If you're still working, women rated their careers, their jobs as being very important, a very important priority. Number four, this is usually when somebody in the audience says, oh, number four must be husbands. No, not yet. Husbands is on the list, but not quite yet. Above husbands is pets. And when you think about it, this should not surprise us because we love our pets, don't we? The University of Guelph did a survey on where they have a veterinary school. They did a survey on how people feel about their pets, and the vast majority of women said that their pets were more understanding than their husbands. Which, if your little sweet little puppy there, those big eyes. So underneath the below the pets in priorities was spouse, right under the dog. And last on the list, when I ask women in my audiences to guess, what would you think would be last on that list after family, home, work, spouse, pets, or pets and spouse, sorry. What do you think would be last on that list? It was yourself. Yourself. So in this Mayo study, women ranked their priorities so that all of those other people or things came first. And then after that, then they would concentrate on their own needs. Now that is pathetic, isn't it? That even in the middle of a heart attack, women would rank themselves last on their list. And we do this because that's how we're raised. We're raised to be caregivers. We essentially are the family caregivers. We're the ones who you may have been in a family where, for example, if your husband got a gift for a birthday, you wrote the birthday thank you card. for the husband, an adult. And we do this certainly with our children and with our neighbors and with our friends. So I often ask my audiences, what do you think I would have done when I was on that flight from Ottawa to Vancouver with those kind of symptoms and I was too embarrassed to call the flight attendant over? What do you think I would have done had it been my daughter Larissa who was having those symptoms? Do you think I would have said, well, just, hang in there, honey. We'll be home in 9 hours. No, I would have been screaming blue murder. I would have been demanding that they turn that plane around. And I think most of you would have done the same thing, even if you didn't know the person sitting next to you. If a person sitting next to you was clearly in medical distress, you would have been ringing your call bell and demanding that the flight attendant get help for this person, even if you don't know the person. So why don't we do that for ourselves? And
Mhm.
again, it's a much bigger issue than just heart disease because this is how women are raised in our society.
And there's a scientific reason why we do it. Is that when we're in that fight or flight mode and the adrenaline is flowing, our prefrontal cortexes and our frontal cortexes are not getting the information rapidly. It's all going to the lizard brain in us,
Yes.
and that's where and that part of our brain actually doesn't have any language. And so we can't express ourselves when we're in that. And that's why we can express ourselves for others when we're not the person who's in that difficult spot. I don't want to throw men completely under the bus, or give them a free pass on this, because the number of times that my male patients would come in and I would talk to them and say, how did you get here? Oh, I drove here. Oh, so your car is underground? Yes, it is. Well, we're gonna have to deal with that. Um, but why did you drive here? Well, I just thought it was heartburn. But I will say that men are taken more seriously when they land in the emergency room than women are. Men are put through the whole gamut of tests. And one of the things that you experienced was that women's troponin levels, the amount of, it's a chemical that's broken down when you've got um, bloods, or when you've got muscle cells that are dying. So they can see the amount of, how fast that's going up. But it's lower for women, isn't
It is.
it?
And yet, women are not measured by that lower ceiling. They're measured by the higher number that works for men. It works for men, and all the research has done that, except for in Vancouver. You have a researcher at St. Paul's who has suggested that if only women's that threshold was lowered, that we would be saving lives in the emergency room because those test results for women would be lower because they are lower. So it's really, I have hope for the future that this kind of research will become widely distributed and then doctors will start interpreting the test results. Because as soon as the doctor says troponins are normal, really, you can basically kiss your cardiac diagnosis goodbye because doctors treat to numbers. And if the numbers tell them that this is normal, nothing wrong with this patient, coupled with this implicit bias that researchers tell us is very common in women, then it's really tough to get an accurate cardiac diagnosis.
Mhm. We minimize our symptoms. And one of the things that we need to do is keep on going back.
Yes, yes.
And that's another barrier as far as I'm concerned for a diagnosis. Even when I was doing this nursing 20 years ago, we were talking about people who automatically come in, when they come in with any kind of these symptoms need to be fast tracked. And that has never happened.
Mhm.
So I went with a girlfriend who was having chest pain, and we went to a local hospital, and they came out and they did blood work. They pulled her aside to do an ECG, but it was 3 hours before she was taken into a room. And indeed, she had elevated troponins and her ECG was abnormal. And so she should have been taken in right away, whereas men are taken more seriously. And that's
Absolutely.
a really big concern.
It's huge. And I can guarantee you that had your friend been a man, they would have seen to him more quickly. Because as soon as you say, this is why it's important to say, I think I'm having a heart attack, and then stop talking. Don't, because inevitably, and I think we chatted about this before, Connie, about how Dr. Catherine Kriatsoulos, who's a Canadian researcher but is at Harvard now working, and her special focus is on how women speak to doctors during their heart attacks. And that's really a huge barrier that women have to get over themselves, because what we'll do is we'll say, I think I'm having a heart attack because I'm having this chest pain, or any one of any number of symptoms. And then they'll start adding things like, it's probably nothing, or I was gardening yesterday, so it could be a pulled muscle. So then they'll start self diagnosing. And the more they talk, the more the doctor is saying, yep, that sounds reasonable. And there goes your extensive, any more further cardiac testing. So women have to stop explaining or self-diagnosing themselves or apologizing for being there. There's an English doctor that I follow online who's he wrote a lovely piece about how he always says to parents who bring in their child because the child's had a terrible earache for days and is crying and fiddling with his ear or whatever. He always says the same thing to these parents who, as soon as they find out it's fine and it's not serious as they hope, he always says, you did the right thing by coming in today.
Mhm.
And can you imagine how I would have felt if that doctor that sent me home had said, uh, we didn't find anything today, but you did the right thing by coming in today, which I did. The only smart thing I did during my entire heart attack experience was I went to emergency right away. Most women will wait and wait and wait, thinking, oh, I'll see how it feels tomorrow. I'll call the doctor. And I once met a woman up island who told me that her first cardiac signs, and they were really obvious, they weren't these vague, atypical signs you might hear about. And she looked so bad that her grown son said, Mom, I'm taking you to the hospital. You look terrible. And she said, honey, this was the morning of Christmas Eve. And she said, honey, I can't go to the hospital. I have 12 people coming for Christmas dinner tomorrow. So in her mind, she'd already made up her mind that there was no way she was going to emerge. So we have to be ready to go back and go back frequently. Another woman that I met while I was at Mayo, she was like me. She had classic textbook symptoms, and she went to emergency where she was told, it's not your heart. And she said to the doctor, I know my body, and something is terribly wrong with me. And the doctor still insisted, every day it was a different diagnosis. By day 3, she was being told that she was offered anti-anxiety medication. On day 4, she went back for double bypass surgery.
Mhm.
So here's a woman who suffered for 4 days, but every day she had gone back to that emergency. And that woman is my hero because that's what I should have done. She was in a similar situation to me in that she had classic textbook symptoms, but she, unlike me, because I got too embarrassed to even consider going back, it took me 2 weeks for me to finally until the symptoms were so unbearable that I forced myself to go. Even then, I was kind of nervous, thinking, I know they're going to send me back and it's going to be more humiliation. But if that doctor had said to me, you did the right thing by coming here today, wow, I think I would have been okay about going back the very next time I had those symptoms.
Things that you brought up, Carolyn, was that if it had been your daughter sitting next to you, one of the things that I I talk about a lot is having a health representative, having a substitute decision maker. And my encouragement to everybody is to take somebody wherever possible with you to the emergency room. So when because you're already assertive person and you were unable to speak for yourself. So a lot of women are a lot more passive than you. And it's really, really important. The studies have shown, and I can't pull the statistics out of my head right now, but women who are alone have much poorer outcomes in all things, not just heart disease, but they've got a breast lump, no matter what it is often downplayed.
Yep.
So have somebody with you. Number one, having a witness can make a really big difference. But they can also be the ones who are tugging on the nurse's sleeves and saying, this is getting worse.
Mhm.
Um, Somebody just wrote, I think that potential embarrassment is a large barrier as well as not making a fuss.
Oh,
And
yeah. Hmm.
so having somebody with you can your mom, you're not making a fuss about this. That
Yes.
this is important.
Yes.
And having somebody else raise the alarms can make a big difference.
And sometimes we see, for following up on what you've just said about tugging at the arm of the nurse, sometimes women, even when they do take somebody with them, they'll be minimizing the story already by the time they get to the doctor. And then the husband will come in and say, she's really suffering. Something is really wrong with her. This is what I've observed. And the doctor then can take the husband's word for it because he's sort of sticking up for his wife's complaints. So even the language that we use in medicine is so interesting, right? Like doctors will say that the patient denies having taken this medication, or the patient claims that this is what she's experiencing. That's really insulting, isn't it? As opposed to the patient has these symptoms and this is what's happening to her. So,
Or even if they just say she says she has.
yes, yes, those words like claims and denies, or she failed her last round of chemo. She didn't fail. Nobody fails chemo. The chemo fails them. That's what happened.
Exactly.
But
Yeah.
in medicine, we have a lot of words that are loaded like that.
One of the things during our pre-talk that you talked about, and I think it's really important, is when bad marriages lead to bad outcomes, since
Mhm.
we're kind of on this subject.
Mhm. Yeah, that's really a shockingly awful thing to contemplate, because I think we all trust that if we have a spouse or a partner, whether you're a man or a woman, that it's your spouse or your partner who's going to help you. If this is the for better for worse part of your vows, right? So that when you get the for worse day and you are sick, you trust and hope that that person will be your best ally, will drive you to your appointments, will sit quietly in the waiting room. Like what somebody said, you shouldn't be looking for walks on the beach when you're choosing a marital partner. You should be looking for a man who's willing to hold your purse in the hospital waiting room. Isn't that good? And
It's
yet we
so
know,
incredibly true.
yeah. And yet we know from research, and I hear this all the time, just from my blog readers who write into me with their comments about. It's so shocking that I've done a couple of articles just listing some of the comments that they made. Like, I was having these symptoms. I woke my husband up in the middle of the night, and he said, "It's probably nothing. Go back to sleep." And then she woke him up again for early in the morning to say, "I'm really getting worse." And he said, "Well, after you make my breakfast, then I'll take you to the hospital." I mean, those are just like dreadful scenarios. And you think, if this is how he's treating her when she's telling him that something is dreadfully wrong, imagine what's going on the rest of the time. And a lot of these women talk about why they don't leave a person like that, because they'll often say, he's never helped me, never once. When he gets sick, I'm there with the tea and stroking his hair and putting a cold cloth on his head and constantly fussing over him while he's sick, but he's never lifted a finger all the times that I've been sick, which then causes other people to comment saying, why are you with this person, right? So it's a really complex and horrible situation. And it's easy for some of us to say, well, I would dump that guy in a heartbeat. But of course, that women don't dump that guy in a heartbeat, no matter what happens. Things have to get pretty, pretty bad. But when your heart is concerned, it's really sad, especially. Now, I quickly like to say that not all men are like that. And many, many men are wonderful caregivers and really thoughtful and caring. And they're the ones who are tugging on the nurse's sleeve saying, no, she's telling the truth. Listen to her. And that's what you want. That's what an ally is.
Exactly. Well, I don't know what it is for heart disease, but when women are given a diagnosis of breast cancer, it is the number one time that they'll ask for a divorce.
Whoa.
Can I go through this with him? Is a really big thing.
Yeah.
Yeah.
Wow.
Um,
Well,
some have, yeah,
there's a
but
saying in for heart patients that if one of the partners gets sick during a long marriage, men leave and women stay.
mhm, yeah.
Now
Um,
that's not universal, but there's a greater tendency to see that reality.
exactly. We don't have a lot of time left. It's gone really quickly, and I want to open this up um possible to a lot of questions and um things. But men, you talk about men have denial and stoicism, and the difference between women also have denial, but what's the difference for stoicism?
Yes. A man who came to one of my talks said that during his heart attack, he went in to see his doctor because of his really clear symptoms. And but this man had been a weight lifter and a bodybuilder and a very super fit guy. And the doctor took one look at him and said, look at you. You are the picture of health.
Mhm.
This is not your heart. He was a magical doctor because he thought just by looking at this man, he could diagnose him. But the man was, in fact, having a heart attack. So that stoicism, that I'm tough, I'm a big, strong, healthy person. Um, as soon as the doctor identifies with that and says, oh, look at you, you're perfectly fine. Women tend to be in denial, but for other reasons.
Mhm.
We
Mhm.
rarely we rarely say I'm tough. Well, sometimes we say I can stand it, or I'll call the doctor tomorrow if the pain gets worse. Like right now, I'm on top of it. I can manage it now. Or we used to find this when I worked in the hospital that we'd have prescriptions for breakthrough pain management so that you have a pain pill every 4 hours, unless you're having a pain crisis, in which case we'll give you this breakthrough medication to see you through. And it's remarkable how often patients, even in excruciating pain, would say no to the breakthrough pain medication. Like, it's not that bad. It might get worse tomorrow, and I'll save it for when I really need it tomorrow. So we have that kind of denial as well.
A couple of things came up. Not all life partners are men. Absolutely. Thank you for
That's
bringing
true.
that.
That is
That
true.
thank you
Although I
for.
will say that most of the research so far, you know, looks at, men and women as couples. But you're right.
Mhm.
A partner, a life partner.
Yeah, we're excuse the walk by. Catherine said, thanks for bringing up these uncomfortable situations. And one of the things I wanted to bring up was, with a bad marriage is makes things worse. But it's also when I was a cardiac nurse, patients, especially, you're told after open heart surgery that you're not supposed to lift anything heavier than a teapot for a month, and you're not supposed to exert yourself. And families were sometimes really concerned because the woman was the primary child giver. And oh, so she can't pick up her grandchildren? No,
Mhm.
she definitely can't pick up the grandchildren. What are we going to do for childcare? It was a very common um, theme, and it really made me sad that they weren't thinking about her first.
Yeah.
And let's have this discussion away from mom who just had her heart attack. Uh,
Yeah, which
and
is why, by the way, women will ignore the doctor's orders and go back to their what they consider to be their family and household obligations. And this is research has shown that when men are recovering from their cardiac event and come home, and the doctor says, okay, you'll need this much time to recover, they take every minute of that, and everybody in the family tends to support that. But women tend to sort of fast forward through that recuperation period because things need to get done. And often women are very uncomfortable lying in bed or sitting on the recliner when they're supposed to be resting, when they and watching their family or their spouse do things that they think they really ought to be doing.
I care. Catherine also says, is it really underlying fear underlying that as well? Yes, absolutely. And that's where the fight or flight kicks in and why we're not thinking as well as we should. And that happens in any medical emergency. And it doesn't necessarily happen to us. So it could be somebody else is having the chest pain. And this is not something that we're used to, and it's not something that we understand. And so we can dismiss it. I've seen people dismiss things because they're scared.
Mm-hmm.
I don't want that to be a heart attack for you
Yeah.
because that's scaring me.
Mm-hmm.
And somebody said, how do you, would like to hear about establishing an ally or an advocate and developing this relationship to be able to depend on one or two people who would respond if needed. Hmm.
Well, I would say you could get yourself a patient navigator like Connie, for example. That'd be awesome if everybody had access to a patient navigator. But I wrote about this when I talked about choose your listeners carefully. Now, this is really basic. Something bad is happening to you, and you choose who am I going to confide in? I've had this diagnosis. This is what's happening to me. I really need, especially women, because we like to chat with our friends. That's one of the ways we get through a crisis situation. But often we'll choose the wrong person. And once again, sometimes your spouse is not the correct person to be the listener. Because they're frightened for you. And I knew this from research, but I observed this in my own life with my own son, who was he was both my grown children were out of town when I had my cardiac event, and both of them flew back home. And it was very upsetting for my son to know that this had been happening to his mom and he wasn't here in town for me and he wasn't available and he didn't even know about it for the 2 weeks that I'd had my symptoms. I didn't say anything because I didn't want to worry my children. And if you start confiding in people who in your family, like what my children needed and wanted from me was to be better. That's what they needed. And if I started saying about pain or another symptom that I'm worried about, they can't. It's like they can't cope with that because they're so worried, they're so scared. Like my daughters, when she returned home during this time, she threw open the door and she yelled at me and she said, "Don't ever do this to me again." because, because I had frightened her so much. And then they'd had to catch these emergency flights home because their mother might be dying. That for a lot of children, even grown children, that's too scary. So I knew that they wanted and needed me to be fine. And so what the downside of that is that I would pretend, I would paste on my happy face when they were around and never said anything to them. But I did have, in answer to your the question, How do you get your allies? If you don't have a Connie, you do have somebody in your life that you know that you could. It's the person that you would phone if something good happened and if something bad happened. A friend of mine recruited her sister-in-law. She knew her husband was not good at these kinds of talks, that he doesn't like talking about sickness. He doesn't like hearing about sickness. He has his own. She said, I knew in advance my husband would not be my best listener because it's too painful for him. It's too uncomfortable for him. So she approached her sister-in-law, who is this lovely, caring, empathetic person that she had a little history with. And so she said, would it be okay after she had a ruptured aneurysm. So she knew she was going to be in hospital and then recuperating for some time. And she approached her sister-in-law and said, what do you think? Could I call on you? Could I phone you if I'm, feeling a need to talk? And her sister-in-law felt sort of honored to be chosen. And she said, of course you can. Of course you can. So I would look for those kind of people, nice, empathetic people who are not going to be so frightened of your setbacks that they're going to close down themselves.
I will add to that. Yeah, is that a lot of people approach me and they have nobody.
Mm-hmm.
Friends and family have all died away, and so they're feeling very alone. Yesterday, I have the honor at speaking at the West Van Seniors Activity Center frequently, and I was really watching what was happening in the cafeteria. People join, you have to come out of your introverted closet. Because I'm an introvert. You'd never know I'm an introvert. But if I have the opportunity, like after this session, to just sit back, read a book, those kinds of things, then that's what I'll do. We become more introverted as we get older. And because our friends and our family are falling away, and it takes more work to get out and do things, I would invite you to not only look for people who can support you, but who you can support. So that, because most of the people here are probably not dealing actively with a disease process. You've got time. Go and, if you're a church person, go and get involved in the church. If you've got a senior center around, go and take a line dancing course. Go and start to develop friendships. Ask people to have coffee. I looked around the cafeteria yesterday, and there were particularly groups of women at every table, and they had established those relationships. And so, think about people who will be good listeners. I certainly have filtered out my friendships so that I only have, I have some friends who are the good time friends, but the friends that I have nurtured, and let's go for coffee. It's been a while. Let's go for dinner, those kinds of things. And we've ended up being there for each other
Mm.
in some
That's
really tough times.
such an important point. And it also, there's another point that I wanted to bring up here too, is that when somebody offers help to you, or they'll say things like, let me know if there's anything I can do. This is really common. And it's hard for people, like never would I have said to somebody who said that to me at the time of my heart attack, I would never have said, can you come over and change the kitty litter box for me? I mean, I just couldn't, I don't see myself as the kind of person I could have, I should have. And if my children were around, I certainly would have asked them. But what I loved is when people would say, I'm at the grocery store. What can I pick up for you while I'm here? Or I'm free on Tuesday morning. I thought I'd pick you up and we'd do some shopping. Or what can I bring for lunch on Friday? You have a choice, chicken or fish. And those kinds of questions are they're offers of help, but we have to be willing to accept the help as opposed to saying, no, 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 I'm fine. Don't, even if you're out of bread and out of everything, you would not say, oh, while you're at the store, please pick me up some bread. It's just easier if you remember that people would not be offering you the help if they didn't want to give you the help. So you have to be both willing to help other people by saying those things like, I'm at the grocery store, what can I get for you? And I use that a lot. Ever since it got used on me, I like that so much that now, and it's absolutely not a problem for them. They're there anyway. Then they can pop it off and either stay for a little visit or not. And then you can offer that to them as well. That I'm at the grocery store. What can I do for you? So when you start saying, let me know if there's anything I can do for you, and you say, okay, I will, you have to do that. You have to accept that when you do need something, that they will jump in. And sometimes they'll be too busy or they'll have other plans, but don't take that personally as nobody was willing to help me. You have to be that person, as you were saying, you have to be the person who's the good listener as well as needing a good listener.
Val said more and more elder women are living alone and often feeling lonely and isolated, perhaps empty nesting, divorced, gay, single, and low income. Absolutely. And I don't know if there's a solution to that problem other than being the person who goes out and seeks.
Mm-hmm.
Um, if we could put signs on our door saying lonely person inside, that might be really helpful. Um, and I live in a building where we have 500 people who live in this building. We see each other maybe once a year oh, you look familiar. I can't depend on the community within my building to be my people. And so I have to go and seek it. And I understand that it's more and more difficult to go as we get, we've got a walker, we need to be in a wheelchair, those kinds of things. It's one of the sad things that so many of us have lost connection with churches, because churches were the one place where people would pick up, um, Miss Sally, who was in a wheelchair, and now Sally can listen to the morning sermon on her internet, and nobody knows that she's alone and sad.
Mm-hmm.
So it really is a really big point that we're obviously latching onto something here that's a really big concern. In one of my sessions a couple of days ago with a funeral director, it was, what happens if I die by myself in the middle of the night? Well, okay, that's the ultimate of being lonely and disenfranchised from your community if you've got nobody to check on you. So, one of the things I would say pertaining to heart disease about that is, please, if you can afford a Google Watch or a Samsung Watch, there are lower models that don't cost $500. Get one, because they can tell what your heart is doing. And if your heart goes into VFib or ventricular tachycardia, which are lethal rhythms, you can set it up so that it will call an ambulance for you. If your heart stops, it will call an ambulance for you. If you can't afford that and you're using a medical device of some sort that you wear around your neck, don't hesitate to use it. If you're having that, you're having struggling to breathe, or you've got the chest pain, or you've got pain up into your jaws or down your left arm, um, try and override that. This is probably nothing, and
Mm-hmm.
call them early.
Yeah. And that's the key, isn't it? Because eventually things will get so bad that we will call somebody. But it's always better to catch it early. In cardiology, they say time is muscle. So the
Mhm.
longer your heart is deprived of that oxygen to the heart muscle cells, the worse the outcomes are. They know that, which is why doctors always want you to come early. And that's also the tragedy of doctors who say, come early so we can help you, because I came so early that I probably, once my tests started being normal, they moved on. They moved on from cardiac to cardiac diagnosis. So, but generally speaking, the earlier you can do this, the better.
Try and tell your little lizard brain to be quiet, that this is important and that you need to do something about it. Um, I want to, before we hopefully can move on and maybe watch a typical heart, um, I wanted to talk to you, have you talk about pregnancy complications and future
Yes.
heart disease.
Hmm. This
Because
was a,
this will have affected a lot of us and we didn't
yes,
realize it.
exactly. That was my case as well. I found out 2 years after my heart attack, I had no cardiac risk factors. And then I learned after I went to Mayo that pregnancy complications are one of the biggest cardiac risk factors. It's higher than smoking as a risk factor for heart disease. And I had preeclampsia during my first pregnancy. And preeclampsia is a condition where you have a big spike in blood pressure. You often will have vision changes or problems of headaches and swelling. And when your doctor tells you you have preeclampsia, the cure for preeclampsia is having your baby. And then things go away, and nobody thinks about preeclampsia or any other hypertensive problems you may have had. But your Dr. Graham Smith, who is an OBGYN at Queen's University in Kingston, he describes pregnancy as the ultimate cardiac risk or ultimate cardiac risk calculator. So if you have had a pregnancy complication like preeclampsia, like gestational diabetes, like a premature baby, like a full term but low birth weight baby, now, this is really important because that tells the doctor that the baby is not growing as big as it should because the baby's being fed by the mother's vascular system and something's not right. So, a low birth weight but full term baby that's under 5 pounds. That means you have a cardiac risk factor. And Dr. Smith has even set up a clinic at Queen's for his high risk maternity patients. And he's not a cardiologist, he's an OBGYN who delivers babies all day. And he is concerned about the future cardiac health of these mothers who have these pregnancy complications because he knows of the link. And several researchers have published journals journal articles about the importance of telling these patients now you're at high risk, and now we can start. What Dr. Smith does in his clinic is these moms get together. It's kind of like a little mom and baby group now. And they come in and they get their blood pressure taken and they get their weight done, and they know well in advance that they are at high risk for heart disease, whereas I never knew until 2 years later. And I had been a person, I was a distance runner for 19 years. I was considered myself to be a healthy person with no cardiac risk factors. And yet here I had one of the biggest ones and I didn't even know about it. And something else that I've been writing about is that there are cardiac risk calculators online that you and your doctor can access to find out if you are at risk. None of these cardiac risk calculators ask about pregnancy complications because they're all designed for male heart patients. So, how accurate is a risk calculator if it doesn't include those of us who are over 50% of the population?
And add to that, that women who develop gestational diabetes, so it's diabetes during pregnancy, that often goes away after a pregnancy as well. But they have a 30% higher chance of redeveloping diabetes later in their lives. And diabetes is one of the highest risk factors for cardiac disease. So
Mm-hmm.
if you had diabetes during a pregnancy, if you had, and when Carolyn and I were talking about this, I went, "Oh, well, I had a complicated pregnancy then because my son was born very low birth weight." And somebody my size, I'm a big woman, should have been able to produce 10-pound babies. And here was this 5.5 pound baby. So I went, that's a big one. So,
Really? Oh, but we didn't know that back then. We doctors didn't know about that back. back at that. It's really encouraging to me how many doctors are getting on board and now are up island in little Port Alberni. I did a talk to some doctors and nurses and midwives because they want to start their own maternal health clinic, just like Dr. Graham Smith has at Queen's. So interesting that it's not the cardiologists that are setting up these clinics. It's the OBGYN people.
That's amazing. I have put the myheartsisters.org into the comments. If anybody is not used to using what's coming up in the comments,